In reviewing the prior authorization process, we'll address 3 questions. The first question is, why was the interim prior authorization process initiated by the agency? There are no FDA indications or official compendia recommendations for the use of atypical antipsychotics in children under the age of 5 years. Atypical antipsychotics are sometimes prescribed off-label to treat children under the age of 5 years. The appropriateness of this treatment is determined by the physician caring for the child with informed consent from parent or guardian for treatment. Although benefits often outweigh the risk, ensuring the safe and effective use of antipsychotics in children is a primary concern. Developing Medicaid reimbursement guidelines and policy around this issue requires time and thoughtful consideration. The prior authorization requirement provides the agency with an interim step while the program's coverage of atypical antipsychotics for children under the age of 6 years is reviewed. The second question is actually 2 questions. The first being, how does the review process work? And the second, who is performing the reviews? Current prescriptions for atypical medications are approved for continuation therapy. The prescribing physician or dispensing pharmacist may call Medicaid Pharmacy Services for approval. The turnaround time for this process is 24 hours. Prescriptions for new therapies are subject to review prior to reimbursement. The child's physician submits a prior authorization request form to Medicaid Pharmacy Services. The request is then forwarded to the Department of Psychiatry at the University of South Florida. A child and adolescent psychiatrist reviews the request and returns it to Medicaid Pharmacy Services for processing. The pharmacy services staff communicates the review results to the child's physician. The new prescription may be approved for reimbursement, or the prescribing physician may be asked to consider other options. The turnaround for this process is also 24 hours. Finally, the third question is, what are the criteria used in the prior authorization review process? The review process is complex and is not determined by single factors. The child psychiatrist reviewing the request may consider multiple factors such as diagnosis, target symptoms, the severity of target symptoms, the level of functional impairment, dosage considerations, assessment and monitoring plans, previous and concurrent pharmacologic therapies, previous and concurrent non-pharmacologic...
You keep going in and out, and I can't hear you very well. Sorry to interrupt you.
Okay, we'll move the phone a little closer. And I tried to turn up the volume. Beth does have a very soft voice, so we'll try again.
Okay, I'll start again with the third question. What are the criteria used in the prior authorization review process? The review process is complex and not determined by single factors. The child psychiatrist reviewing the request may consider multiple factors such as diagnosis, target symptoms, the severity of target symptoms, the level of functional impairment, dosage considerations, assessment and monitoring plans, previous and concurrent pharmacologic therapies, previous and concurrent non-pharmacologic therapies, psychosocial support, and any other factor or factors that may be unique to the individual child. Individualized therapy within the scope of limited accumulated clinical data combined with close monitoring provides the basis for patient care. And I'm going to turn the meeting back over to Ann now.
At this point, we're going to open the meeting for panel discussion, and we were going to let you guys drive that process. If you have questions for us, we did distribute, we've been keeping a weekly report of the prior authorizations and the patients involved. We distributed that quite some time ago. We'd like to open the discussion to the committee at this point.
Pardon me, can you hear me?
Yes.
At what point can I ask questions?
When we get, is this Mr. Kramer? When we get to the public testimony, Mr. Kramer?
No, this is, my name is Chris.
I'm sorry. Your name is?
My name is Chris.
Are you are not a panel member, so you have to wait until the public testimony period.
Oh, okay, that's toward the end.
Yes.
Oh, thank you.
So as I understand it, the process begins by a submission of the prior authorization to Medicaid, and if in fact it is a child under the age of 5, then it is reviewed by a child psychologist. Is that correct?
Who's the speaker, please?
This is Mr. Lalikas. I know his voice. So as you guys, that's fine. As you guys speak, if you could identify yourselves, that'd be great.
Okay, yes, the prior authorization request, once submitted to the agency, if it is for continuation of therapy, it is approved. If it is a new therapy, then it is forwarded to the USF psychiatrist for review.
So it's a child psychologist, not a child psychiatrist. Is that correct?
No, a psychiatrist.
Thank you very much. I wanted to make sure about that.
Yes.
This is Lisa Cosgrove. Do we have someone from the University of Florida to review what their recommendation? I mean, I looked at all the recommendations, but I don't think there may be other people on the call that do not understand specifically what the recommendations are.
We have recommendations from the Medicaid Drug Therapy Management Program expert panel that met to review psychotropics in children under 6 as well as for other children. These guidelines were developed in 2006 and they will be updated this year in 2008. And these guidelines state very generally that given the current science and clinical experience, the use of antipsychotics in children under the age of 6 is generally not recommended and should only be considered under the most extraordinary circumstances. Disruptive aggression in autism is one such circumstance. I believe we have Dr. Castellanos and Dr. Tandon on the phone.
Yes.
Do you have any comments concerning the guidelines or criteria?
No, that was the basic recommendation. As everyone knows, that you want to be very cautious in young kids. Now, can I just ask, as part of the process, and I had to cut out because I didn't know how to unmute it from the *6, so I had to kind of re-log on. Is there problems with the current process as it exists?